Bonjour, je suis Howell Williams and I am Professor of Dermatoepidemiology at the University of Nottingham. So for nearly 10 years now I have been very committed to trying to sort out the problem of how to measure whether a person with atopic eczema gets better or not on one particular treatment compared with another. And the motivation for HOME, harmonizing outcome measures for eczema, has been the fact that we have many outcome measures for atopic eczema. Now the problem with having so many different outcome measures, especially one country using one outcome measure, UK using a different one, US using a different one, is that we cannot talk, we cannot communicate. So if you, for example, wish to know how does this treatment compared with that treatment, well, if you do not understand the scale being used and what is an important difference, then we cannot compare.
Alors l'harmonisation des moyens de mesure de l'eczéma, ça peut paraître un peu abstrait. En réalité, c'est fondamental parce que demain, toute la recherche clinique qui va se développer pour l'eczéma atopique va utiliser les critères que nous sommes en train de définir aujourd'hui. Et le fait d'utiliser les mêmes critères d'évaluation dans le monde entier permettra d'améliorer l'efficacité de la recherche clinique et donc de traduire très rapidement les résultats des essais cliniques vers le patient. Et ça, c'est fondamental.
You know, for years, we didn't have pharmaceutical companies or outside agencies or healthcare agencies necessarily getting the impact of eczema or being willing to invest to figure out better ways to handle it and potentially prevent it. That's changed now. So as there's more interest in the field, it's even more important for us to have both consistent and unified measures so that we as the healthcare providers and patients who will be on the receiving end will have the best data to know what can help their disease in the best ways.
Now for HOME to work, it requires international and multidisciplinary involvement. So you cannot do something like HOME without involving patients, for example. I mean, who am I to say what is important for a patient? I can have a view, having talked to thousands of patients and families, particularly children and parents over there. I can have a view, but I'm not the same as experiencing atopic eczema. So that's the first point. You need not only dermatologists, patients, regulators, industry colleagues, methodologists, so that you have state-of-the-art methodology, and we have all those in HOME. Also essential is the international involvement. We can sit in a group in the UK and say these outcome measures should be used, but you know, then colleagues in France will say, oh no, we like this particular one. So it has to be international from the start. And it also means that those of us who come to HOME meeting with a preformed idea, we must be prepared to let it go. Now there's one very important point I want to make about HOME. It's about core outcome measures. In other words, if you wanted to do a study in France which included some of your favorite measures, by all means do it, you can do it. What we're asking for is all future clinical trials, please measure something to do with symptoms, signs, quality of life and long-term control. Now we have made good progress in the various HOME meetings to agree those 4 domains.
I have been knowing Howell Williams for many years, and I think he's one of the greatest dermatologists and both clinicians and epidemiologists ever. And when I heard that he is going to start this initiative, it was clear to me that I wanted to be part of it, because I think it's very important that outcome measures are defined by experts in the field and to a certain degree independent from industry. And there's a real need to harmonize outcome measures. We have so many different outcome measures in atopic dermatitis, so there's a real need to harmonize them. Even closer relationships between those people who are really interested in the disease and in the patients. So, of course, since I'm active in the field for many years now, I know many colleagues, but through HOME I have even met more colleagues that I did not know before, and to whom I now have a very good relationship. So that's something I also expect.